Okay, so my topic is about tic disorders, which you probably know it as Tourette's. Its general description and main category is tics are rapid, sudden, non-rhythmic, and repeated muscle movements and or vocalizations. So when you hear about people that just spit out curse words because they can't control it, that'll be an example of a tic. And the most common term for it is Tourette's. Its prevalence is 3 to 8% per 1,000 school children. Males are also more common to have it affect them. So, for example, for males, the ratio for them getting it is 2 to 1, and the ratio for females getting it is 4 to 1. It's also lower among African Americans and Hispanic Americans, but that could be due to differences in availability of care and treatment for the disorder. Its age of onset is typically 4 to 6 years of age, and severity is generally worse at the ages between 10 and 12. But later in adolescence, it usually starts to get better. Tics wax and wane, but they generally get better during adulthood. But you can have periods where they're worse than others. For example, if you're in a high anxiety situation, you might have your tics be really bad. Symptoms and typical course are that tics can get better over time, like I said before, and they can also begin to affect different muscles than they did before. And you can also resist some tics, but you kind of just keep thinking about it until you do it, and once you do it, you feel relief. And some people also repeat their tics over and over again until they feel that they get it perfect. They can also lead to other disorders such as ADHD, OCD, anxiety, or major depressive disorder. It can also lead to things like bipolar disorder. Tics are, like I said before, better in calm situations, and people with tics may accidentally watch a person that they're an authority figure and start to mimic the movements that they're doing. In some cases, tics can resolve within a year, so that would be classified as the provisional tic disorder, which is different from the chronic or persistent tic disorder or Tourette's because they go on for more than a year. Treatment for this disorder, you can do breathing exercises to reduce stress, or you can have therapy to reduce the psychological distress that you might be feeling. If you experience a lot of psychological distress, that can be the stress that causes your tics to come out more. There's also antipsychotic drugs, but there's a lot of issues with these drugs because they don't fully fix the symptoms that you're having, and not only that, they can also have bad side effects, which can lead you to having other problems. So it's not really worth it. You can also just like I said before, therapy with a therapist, just talk out your problems, and they can help you manage your tics. And yeah, that's it.